Well, when he played at Nebraska, Sean Fisher probably learned more about the human body than he would have liked to at the time, losing one season to a shoulder injury and another to a broken leg. Now Fisher's focus has completely shifted from the football field to the medical field. After spending most of his life in the Midwest, Sean Fisher now calls Seattle home.
A little bit grayer, but we don't have the real severe winters that I'm used to in the Midwest. So from that standpoint, like 50 and gray in the winter seems like a win compared to, minus 20 and snow.
Fisher is currently in the third of a 6-year residency at the University of Washington Medical Center, where his focus is plastic and reconstructive surgery.
A lot of folks kind of associate it with just cosmetic surgery, but the reality is that you can do a lot more with it. So we do breast reconstruction for cancer patients. We do extremity trauma, which we see a lot of out here in this region. You do craniofacial cases for young children that are, have sort of congenital defects. You can do hand surgery, so you kind of get to operate on all areas of the body.
Fisher played linebacker at Nebraska from 2008 to 2012. He could have played one more season due to a medical redshirt, but instead decided to attend medical school at the University of Chicago.
The NFL is, great to think about, and it's kind of enticing. It kind of feels like you might, win in the lottery a little bit if you're able to sign a big contract, but just looking at it objectively, that was not going to be a place that I was going to ever find myself. I didn't feel. And so, it would have been fun to come back one more year, get to sort of be one of the leaders of the defense. But at the same time, I knew I had a better part of a decade in terms of additional training and schooling that I was going to have to do.
Despite being away from the gridiron for nearly 8 years now, the 30-year-old still applies the lessons he learned on the field.
And Sean Fisher stumbling.
The biggest thing that it helped me with is that, when I went from football and undergraduate studies to medical school, it didn't feel as daunting as I think a lot of people had sort of hyped it up. It felt more like a breath of fresh air, was that I was able to sort of focus on one thing.
While the Millard North alum admits his workload is lighter these days due to the coronavirus pandemic, Fisher's willing to help whenever and however needed.
You kind of feel like a little bit almost helpless, like, where the help is needed doesn't necessarily fall under the scope of some people's practice. As people are going to continue to get sick, people need healthcare, and we've all kind of signed up for wanting to, have the privilege of being able to take care of folks in that instance. I'm probably going to come into contact with this at some point, regardless. So the best I think you can do is kind of follow guidelines, wash your hands, try not to touch your face, try to limit personal contact with others, and just continue to do the job that I signed up to do and feel privileged to get to do on a daily basis.